Welcome to the video huddle for Wednesday, April 8th. A video town hall was held last night hosted by Sean Dwyer, president of VUAH. I wanted to share some highlights from the meeting. Dr. Brian Harris, Executive Director of Medical Specialties, gave some tips on helping to prevent the spread of COVID-19. Social distancing and hand hygiene, they really work. Fabric masks work to help us prevent touching our noses, mouth, and face and further spreading the virus. He recommended changing clothes and showering upon arriving home to help decrease the potential spread of COVID-19 in your home. Sean Dwyer discussed a key focus for the organization. Job security and income for medical center employees are key focuses for the senior leaders. They are committed to keeping the workforce employed and at full salary during the pandemic. We all need to continue to be flexible to do what needs to be done to take care of patients. This is a big commitment by the leadership team to the employees of the medical center. Sean spoke to the question of paying hazard pay. At this time, the medical center is not paying hazard pay. We are a tertiary quaternary medical center that cares for complex and infectious patients. This is what we do. The medical center is able to provide PPE that meets directions from the CDC to help keep employees safe. Dr. Warren Sandberg reminded us that social distancing and hand hygiene are working, but we must still remain vigilant to help decrease the spread of COVID-19. A statistical model forecasting patient volumes estimates a peak in patients to occur the week of May 4th. Remember, this is an estimate. The hospital continues to provide outstanding care based on outstanding planning that has been occurring across the organization. The hospital rescheduled elective surgical procedures, trained specific teams to respond to COVID patient needs, segregated the patients in 8 MCE and MICU, and secured ample amounts of PPE to serve the COVID patient population. Please continue to remain focused on high-quality care, social distancing, and hand hygiene. Thank you. Robin Stephen, our Chief Nursing Officer, discussed the care model being developed to serve patients during the anticipated surge. To ensure there are enough caregivers to meet the needs of COVID patients, nurses, care partners, and other disciplines who work in other areas of the organization will be receiving training on inpatient workflows. These other team members will be assigned as a part of an inpatient team led by a frontline VUAH registered nurse. These small teams will develop a plan every shift to take care of the patients they are assigned, which works with the skills each team member brings. As an example, the licensed practical nurse, or LPN, on the team may feel very comfortable administering medications and documenting them on the MAR and Epic. This would free up the registered nurse to complete other patient care needs that only a registered nurse can do and extend his or her ability to complete these care tasks for patients. We will also see an increase in agency nurses and PRN staff during the pandemic as well. Overall, this was a great virtual town hall. We have excellent senior leaders to help us through this pandemic. The procurement team and narcotic room staff have done a phenomenal job in building a COVID strategic reserve of essential medications to be used for COVID-19 patient care. Your leader will be communicating specific information on the medications that are included in the strategic reserve. A special thank you to the sterile products team and the OR team who worked diligently to supply a dose of Rystab to a patient in the OR. The teamwork and the communication was gold standard. Thank you very much. This concludes the video huddle for Wednesday, April 8th. Thank you.